I'm Martina Wick, and I'm back again, and now I'm black. Last time I met Dr. Nassif and Dr. Dubrow for getting really big, expandable butt implants. I want to have butt implants.
How big?
1,500 maybe.
So about as big as your breast?
So you want 1,500 cc's per cheek?
Yeah. They told me expandable butt implants in this size are not possible. Oh, okay. Maybe it doesn't work.
It's a little bit too much, right?
I was a little bit disappointed, but I'm still working on it in Germany. I was at the Consultation for a butt implant. We came off topic about tanning, and for a long time I wished me tanned skin because I've never had summer tan. I was too pale. Then he told me he knows a colleague who is doing a test. It's a new medicine to get a little bit summer shade. The doctor gave me 3 injections in my belly. The medicine started getting me tanned from the first weeks. Every 2 weeks I had to change my makeup because much darker. And in the course of time, wow, it's so fascinating. Also, my eye color changed, my eyebrow color changed, and also the hair color itself. I'm really proud that it works for me so well, and so I decided to support my body to going a really African girl. I bought a wig, black curlies. When I posted the picture, my social media exploded. In 3 days, I got 7 million reactions. At first, they thought she's joking. No, I don't want to joke. I love the black skin and the black features, and so we have to go for lip injections very often to keep up my African style. And now I'm really excited to see the doctors again because I want to ask them to do a nose job for me to look more African style. Also, we're happy that Mama Nature and this new treatment and me work together as a team.
Oh, it's so beautiful here. What do you think?
Oh yeah,
I like the sun.
a lot of sun for a lot of color.
We both have the same treatments, the same, and for you it works so well, but for me it works, but not so good.
Michael and I got the treatment at the same day. He said having more tan is really good because Michael is a blonde boy with blue eyes, and in the past 5 minutes out without sun cream and he's really, really red. Can you help me with my shoulders?
Yes. Martina and I love it to be tanned very much. And if we go in the sun for a short time, it goes very fast, much darker. This evening you will darker again.
Yeah.
If the people see you, they all think that you are an African girl.
Yeah, it's so funny.
Do you know at the
African shop?
when you go inside the African shop and you tell I'm not African, I'm born as a white girl, they say, oh, that is not possible.
Being black, it's not a costume. I hope it will last up to the end of my life because now I have a lot of friends in the black community.
I'm so excited about the appointment tomorrow. Do you think Dr. Dubrow and Dr. Nassif will remember you?
No. When I was last time there, I was really white and much smaller. Maybe.
Yes, the breasts were also much smaller.
I think I will be really, really happy if they can work out the nose. I think I need a nose like...
Martina was every time a beautiful girl, but now Martina has become a dream girl. I hope that Martina will achieve her African look. I hope it so much. It's so beautiful.
The
Yes.
journey is the goal.
Yes, I think you become from more to much and you become more beautiful.
Michael, he's more in love with me? No. In compared to the past. Shall I remove the hair?
No, it's good. And one together. Good?
Wait, that's
So, okay.
I'm proud to be black, yeah? It's beautiful.
So beautiful pics.
Yeah,
Our next patient is Martina Big. She came before. She had very large breast implants, but she wanted to match her butt to her breast. She wanted more buttock projection. We successfully advised her against
Not to do it.
Right. Martina is back. So she wants to see you now about the possibility of doing something to her nose. I follow her on social media. Since we've seen her last, she's made a few changes.
So let me guess, she didn't listen to what we said.
See whether you can pick up some of those changes, okay? So why don't you bring Martina and Michael in?
Can you please send in Martina and Michael?
Good morning.
Hello.
Nice to see you again. Yeah, we met last year. I was a white girl with blonde hair. I changed meanwhile from a white woman to a black woman to an African look.
By the way, just say it. What? Paul is completely dumbfounded. I'm used to him being dumb, but not so dumbfounded.
This is no fake, it's a new medicine.
No, it's not. No, this is not.
This is real. This is melanotan.
No,
Well, it's a relative of that. It's an MSH stimulator.
You actually just changed your You're serious.
Anyway, it's great to see you. Let's talk. Have a seat. Let's talk about this.
Thanks.
Is this amazing?
The doctors are very professional, but to shock Dr. Nassif so, it is a sign that Martina's change is really hard.
You had... Are you okay? Can you handle this?
Hold on. Did you really? This is real?
This is real.
There's actually...
Give me some oil.
This is real pigment. They injected this in you, yes?
Yeah, in the
They
belly.
gave you an injection.
In the belly.
One injection?
3.
So you've had 3 treatments.
Yep.
I had the same treatment, but for me it don't work so well. It's still in approval.
So it's in a testing phase.
Yes.
These drugs have been around for years. You inject it, it stimulates MSH, melanocyte stimulating hormone, to increase melanin production from melanocytes. When you inject melanotan into the body, it stimulates all the pigment-producing cells in your body, wherever they are, in your eyes, your skin, your hair, to produce more dark pigment. So the drug I'm familiar with, in this country it's illegal. You can't even experiment with it. These drugs are very dangerous. Have you had any side effects?
No.
Did you throw up?
It didn't.
Do you have any joint pain? Pain
No.
in your...
No.
No pain?
Was this one of the complications described that you would go this dark?
Her melanocytes are turned on. They're upregulated.
Okay, but are they going to downregulate or is this sitting here?
No, this is reversible, right?
Because the drug is new, he can't say the exactly period how long it works.
But I won't go again because I like it. It's not a complication. I don't think I'm going to wake up and going, oh, now I need to go back very soon. No, I'm going to stay black.
As a doctor, darker skin is better skin because it's
protected
better
against
designed to protect you from the sun. So do you plan on staying this color? Do you
Yeah.
like this? You want to be
Yeah.
this way for the rest of your life?
Yeah, that's why I'm here for changing my nose.
How many nasal surgeries have you had?
Only
It-
one.
Yeah.
You had one.
For
2012.
a smaller nose, it was in the past.
What exactly do you want to do with it?
A little bit wider, a little bit like this, but this is too much.
So you want to take your tip, push it in, and make your nostrils also wider?
A little bit, yeah. In autumn, I'm going to visit Namibia to learn more about the cultures of the Africans.
We want to learn more about the real African people.
Are you guys married?
No, we are still preparing.
Do you guys plan on having children?
This is an interesting question.
This is a difficult term.
A lot of people ask us.
Because the people are talk, will the children white or black? And
Martina, Michael, let me tell you something. No matter what color your skin is right now, your DNA, your chromosomes are not dark.
there are no medicine to have effect on the DNA.
No.
No.
No, and you don't want to, wait a minute,
You don't want to trust.
you don't want to do anything like that.
You change your DNA, that's how you get cancers and immunology problems. But anyway, don't worry about that. You're not changing your DNA.
Let's get you in the room and let's examine you.
Yeah.
We'll examine your skin, we'll examine your nose, and we'll go from there.
That's a good idea.
Let's go to you. This is an opportunity for us to examine Martina and Michael. They got themselves involved in a crazy experiment. Now it's our job, our duty as doctors to make sure they're okay. Wow, look at you too. You guys are almost the same color. Michael, did you gain a little bit more weight since last time we saw you?
Yes, a little bit more.
A little too much schnitzel.
Here, come on.
Yeah, so let's look at Michael first. So all of these moles, Michael, they've gotten darker? Yes.
Okay, so they did become darker. So you need to go to a dermatologist when you get back to Germany. I mean, when you have a mole and it turns dark, that could be a sign that you may have a melanoma. So if you have a mole that starts turning dark, go have it checked. So when I hear of someone turning themselves dark, I'm wondering, can that take their moles and make them cancerous? Put your head back for me. Let me just take a quick peek. Septum is straight. Well, actually, no, it's not. You have a deviated septum all the way over to the left. Okay, turn your head that way. So your nose is really over-rotated. Martina has legitimate issues with her nose. Her nose is over-rotated and she's got a deviated septum. She is actually a candidate for a revision rhinoplasty. What's interesting is you did have an over-aggressive rhinoplasty, which is something that I always fix. What that would entail would be me taking cartilage, most likely from your rib, and I need one here, here, here to lower it, and something here. This is all doable. I can fix your nose, make it look a little bit less pinched, and lower it a little bit, which will not give you that look you want. But for me to do what you want, I have to go the extra mile. When patients come and they want us to change them, let's say they want to go from a male to a female, they go through a process, and they make sure in their life with doctors' help that that's really what they want to do.
Yeah, it's not the costume.
We would feel better if you lived with this skin for a good couple of years. Martina has issues that I can fix, and I want to help her. But at the same point, it's irresponsible of me to do what she wants right now. I really want Martina to wait before she makes a decision like this, because one thing, we don't know how long this crazy experiment is going to last. This is possibly reversible. Once I make a change here, it's done. Live with this for a little while. Are you okay with that then?
Yeah.
Yeah.
You're not going to go to Germany and have someone else do it right now?
Yeah, I'm just learning about collecting information.
Good.
I like the doctor's advice. I will take my time to learn more about my new self.
Well, listen, good luck with everything. You go
Yeah.
see a dermatologist when you get there.
Thank you for coming in.
There.
Safety first.
Very good. Thank you.
There you go.